Okay, so you said everything is curable.
Sure.
So, but how come they say what's your opinion on the back to the B12, Dr. Morse? A B12 deficiency, the symptom, it's irreversible brain damage if you get a deficiency. What are your thoughts on that one?
My
Nerve
thoughts on
damage,
that,
irreversible nerve damage.
that is a medical doctor's thinking. That's not a naturopathic thinking. And if there's a naturopath that thinks that, they're not a good naturopath. I've been a naturopath 51 years. I never consider B12 ever. And all my people, we're famous for it. We cure everything. And it's like, I never could. Well, I got some lad wrote me and said the same thing about B1. If I don't get B1, I get my B vitamins, I have brain damage. It's like, oh, come on, kid. No, 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 no. It's just these docs are like wackos. They do not understand how the body works. They don't understand the lymphatic system at all. They don't understand chemistry. They're lost in some kind of pseudo thinking that the body's too alkaline for some reason. They think they can use an acid at 1.5 to 2 pH in someone's blood. And of course, that destroys all the cells. I mean, they just don't get it. They're fixated on effects instead of causes. And
Mm,
they're just taught wrong.
that's good. They're fixated on effects instead of causes. That's
Yeah.
good.
Yeah,
Now,
if you take
okay.
a symptom and you don't understand chemistry and you don't understand how the body works, because A&P is still infant in its teaching medical doctors how the body works. A&P, I've got a good friends that are A&P professors, and they're not allowed to teach what they know. Yeah.
Mm.
Yeah, if you ever talk to Patty, she is a 25-year A&P professor. She's also a biochemistry professor. When I first came out with the fact that the kidneys need to filter and that this controls the lymphatic drainage of systemic waste, she called me up and said, "You just answered how the body gets rid of metabolitic or kinetic waste." She said, "We don't know that." And she's been teaching medical doctors all her life. So she came work for me for a year and she's curing everybody of everything. She said, "But I miss teaching." So she went back teaching A&P and medical colleges. But she said, "I can't teach what I know." She says, "I get it in, but she can't teach what she knows."
That is a great point.